Welcome everyone to Their Career Mentors. Today I have with me Dr. Nitin Raithatha. He's an MD Gynaecologist currently working as a senior professor at Pramukh Swami Medical College. And today he's going to talk about career options in patient safety sector. So over to you, Nitin sir.
Okay, so we just start with webinar, but I would like to ask one question. So why one should become a doctor? What are your views? To earn money? To just serve the community? That usually what answers we get is are to have money, to have a fame, to have a name in the society, and also to serve for a good cause to the community going back. Yes, and giving back to the society as a part. But in current education scenario, if physics, chemistry, biology, if somebody is passed out or then trying to crack the NEET to become a doctor. But what next after he joins for the MBBS, or if does not get MBBS or in medical education, then what are the options we have? Are these options only BMS, homeopathy, dental, physiotherapy, or nursing? No, there are so many options are there. We can go ahead with any career branch and again still can serve the purpose of to serve the society, to have work satisfaction, to have the name, fame, and the money also. And today we are going to go through this presentation for the same purpose. Do you know the WHO has 2-3 years back given this current health scenario of the world? 1 in every 10 patient is harmed while receiving the patient care. About 134 million adverse event occurs due to the unsafe care, resulting in 2.6 million deaths annually. In primary care, 4 in 10 patients get harmed while receiving the health care, and out of which 80% are preventable. There is a major issue. Hospital infection occurs 10 in 100 hospital patients. 1 out of 7 Canadian dollar is spent on treatment for patient harm. And if we invest in the patient safety, it can lead to a significant financial saving. And that's why this today's topic is of patient safety. What else? Other scenario is saying, if a patient is dying from motor vehicle accident, air crash, breast cancer, or AIDS, there is a havoc being created. But today, around 98,000 people die in any given year, and that is quite more than all these three. But these three causes that receives far more public attention. But these are the preventable issues which is not getting attention. And indeed, more people die annually from this medication error than the workplace injuries. 7,000 deaths from medication error alone, right? So this is another survey what we have done in the US. They say is about 20 to 40% all health spending is wasted in poor quality care. So if we think of quality of care and expenditure, the safety studies around 19 billion annually US dollars being spent on the additional hospitalization, litigation cost, infection acquired in hospitals, disabilities, lost productivity, medical expenses, and the economic benefits of improving patient safety are therefore compelling. If we add the financial cost to the human tragedy, then the medical error easily rises the top rank of the urgent widespread public problem, and we need to address it. And for that, a book known as To Error is a Human. To break the silence, this book came in last decade. After all, To Err is a Human. Instead, this book set for the national agenda with the state and the local implications for the reducing medical error and improving patient safety through the design of a safer health system. But since long after publication of this book, there is still the momentum is developing. And what this book ultimately says is the problem is not bad people in the healthcare. It is the good people are working in bad system and that need to be made safer. But still the scenario is not there. There's another question. Why these changes are there? In ancient days, the ancient remedies, only Nadi Vaida was there and things were like good. The doctors are being respected as equal to God. And there is a lot of experience was there from the Vedas as a part. But in the old days, the doctor was the boss. Now the doctor is a one part of the system. And you can see that now the complex medications are there, complex healthcare working system is there. Now robotics is also there as a part. And because of this growing technology, we need to shift from this one bag of old ancient doctor who is visiting to home. Now it's a patient-centric care. If we see, this is not only doctor or nurse. There are the laboratories, there are the imaging services, there are pharmacies, there are paramedical staff and other support staff who are helping the patient treatment. So doctor is only a one part of this entire system. And if we expect doctor to do everything, then he has to behave like Ashtabhuja Durga or nurse. They are not going to serve the purpose. They are doing so many things at one time, and multitasking can create a major problem. What are the problem? It's because of errors, and these are errors are because of human factor, and that is, we should not forget about the fatigue, the stress, the distractions of the multitasking, and personal issues. And so we have to work for the safe surgery. We have to take care of hospital associated infections. We have to take care of the better medication. We have to take care of the safe equipments. We have to take care of the safe environment. And that is why what is patient safety is ultimately it is a to improve the patient care. Doctor must be doing clinical audit. The laboratory safety is being addressed. The nursing audits are happening so that they can have best optimal outcome. Imaging safety is being addressed by different parameters. Pharmacovigilance is looking after the medications as a part. Pyramidal quality champions are working to improve the quality, and support services which creates an environment to work within. So ultimately, patient safety is not only the clinical safety or only the clinical risk management. It is also talk about the facility where the patients are there, the relatives are there, the doctors and nurses are working. It is also talk about the electrical safety, fire safety, and cyber safety. Nowadays, we have to do not forget the technology. Financial safety is a paramount importance. Without the money, we can't go ahead. Each and every moment, everything has a cost. And ultimately, the human psychology has to be addressed, and we have to take care of the human psychology by personal safety. Now, this is a routine scenario of a day-to-day hospital. But what if there is a mass population moving in medical epidemics like dengue or corona nowadays, this is today's era? Road traffic accidents or collapse of bridge or building, so many people at a time having a problem at one point of care. This is a fire in the hospital. There is a mob violence, electric shutdown within the premises when you are serving the patient. How to take care of those issues? Natural calamities and war situation like India-China issues which was there in the border. So everywhere patient safety is concerned, and that is why because of these 2 decades the people are trying to take attraction on the theme. World Health Organizations has now decided to celebrate 17 September every year as an International Patient Safety Day. And what is patient? That is, the patient safety is the reduction of unnecessary harm associated with the healthcare to acceptable minimum, and that is we need to speak up for the patient safety, including doctors, nurses who are really working hard. They are doing their best, but they require a support system, and that is why it requires every time the quality improvement. And now, what is the quality in healthcare? It is the quality is the right service, the right time, the right people, and to the right process by the right processes. If we can deliver the services, then it gives a quality outcome. Or in a single line, we can say quality means fit for purpose. The degree to which patient care services increases the probability of desired outcome and reduces the probability of undesired outcome, giving the current state of knowledge, and that is said by the Joint Commission International. So the patient safety and quality improvement, can say it's a two sides of the one coin. So if we take care of quality improvement, it will automatically take care of patient safety also. And when we talk about quality of care, we also do talk about the patient safety. Now, quality of care or patient safety talks about what? It is a timely care with the patient-centered care, which is effective and efficient. It is equitable and providing safe environment as a part. So that is take care about the quality of care. Considering these all parameters, the Indian government is working since 1 decade. They have started few initiations, and one of the good initiation was the NQAS in 2012, what they have started. And after that, they have come in with the Lakshya program. They are coming up with the another patient safety initiative framework. And out of all these 3, this National Patient Safety Initiative Framework is very much important, which talk about the surgical safety, injection safety, blood safety, medication, medical devices, safe organ tissue and transplant related issues, biomedical waste management, and the patient safety research. The research is also an important aspect. So that is for the India, but for the government initiative. But this is the scenario of the Indian healthcare, where majority of the healthcare is being provided in the private sector. Now, what to do for the private sector, which is not controlled directly by the government or any of the organization? For that, the government has developed a quality control of Quality Council of India, and they have decided to have accreditation for the healthcare organization. It is a voluntary process just now, but slowly it is becoming gaining an eye, and in future the accreditation becomes one of the gold mark. Why? Because accreditation is a public recognition of achievement of accreditation standards by healthcare organization, demonstrated through an external peer assessment of the organization level performance in international standards. To achieve that, what we need to do? And for that, in India, these are the bodies who have developed, like Quality Council in India has developed a National Accreditation Board of Hospitals and Healthcare Organizations, National Accreditation Board, which is is also accredited in the blood banks. There is also for the laboratories accreditation as well as IUS program. NQAS program under the NHRC, they had also developed accreditation for the government facilities. And ISO 9000 family is also providing some accreditation system with the healthcare part. There are also some international bodies who are also giving accreditation to across the world, and Joint International Commission (JCI) is one of that. And ISQA, International Society for Quality in Healthcare, which provides a framework under which this accreditation body is also providing assess, so that the quality of accreditation process is also being maintained through the ISQA. Now we talk about the main part. The background of patient safety and need of quality improvement is a now major aspect, and that is why it is a futuristic career option for the all who are aspiring after 12th to go in medical field, but also who are at the mid-career position or anywhere in their career, and they want to fulfill their dreams for serving the patient with job satisfaction, at the same time giving back to the society. Patient safety is a major area where they can develop their career. Now what they can be a patient safety champion or executive. See, when they promote it further, they can be a patient safety manager, they can be a patient safety specialist, or they can be a patient safety consultant together. These are the different options. Who can opt for it? Obviously, the doctor, clinicians, he may be MBBS, BAMS, dentist or physiotherapist, or nursing professional, or hospital administrative guys who are looking after the administration. All they are the main three cornerstone for developing quality and patient safety part. But not only those, who are the laboratory people staff, the pharmacy staff, the imaging technicians, paramedics, BSc medical technology, and other engineers, designers who are in the production of the biomedical equipments. They can also have a career in patient safety and quality improvement. These are the four type of career part, if you can see, for any career options. And one thing is a job. So all healthcare organizations will have opening doors for patient safety and quality improvement. There are special cadres and special team is being appointed in each and every hospital. It can be a PHC, it can be a multi-speciality corporate hospital, or it's a very big AIMS hospital like in the topmost hospital in India. There are professionals individually working for the patient safety, and they are following a teamwork as a part. It can be a business or it can be entrepreneurship. Like thinking out of the box, they can develop some new patient safety initiatives, and they can establish in the market, and they can go as an entrepreneur also. So if we see in detail, in a hospital or healthcare setup, he can be an executive, a nurse can be an infection control nurse, or a doctor or a safety officer. He can be a head pharmacy, anyone. If we go further and grow further, can be a team leader, quality manager. He can be reach up to the medical director. And I know there are people who are basically started as a nursing career, but now they are the CEO of the topmost hospitals in the South India or in the North India. I also know some of the engineer who had developed this patient safety concept in their mind. They had grown their skills, and now they are again deputy director or medical director positions in some of the institutes. They can be independent safety consultant. They can be a nurse consultant. I know many nurses, they are now freelancingly doing patient safety consultation to the different corporate hospitals across the metros in the many projects by small areas like tier 2 and tier 3 cities. They are providing nursing consultancy independently. There are also quality consultants, and there are small organizations who are from the inception of the hospital. They are taking care of these hospitals, building, designing, developing, commissioning of that hospital, and then running the further hospital. They help the team of the hospital to go ahead with the patient safety in hand and quality improvement ongoing part. I know there are CEOs of accreditation body are also there who are striving for the patient safety and quality improvement. So it's a journey, and they can earn like anything. It can be 30,000 per month to 1,30,000 per month. It can be 3 lakh per month, or sky is the limit. So there is nothing stopping from earning as far as earning is concerned. Future, what is the future is there? In the course of curriculum now, this patient safety is mandatory becoming for the all medical nursing and medical hospital administration education. It is a mandatory requirement for government by IRDA. So if any hospital gets to MPanel, they have to have accreditation. And to have accreditation, patient have a structure and the functioning system in place to take care of patient safety. Electronic healthcare record, the technologies and Internet of the Things are coming up in the big way, and we have to think of patient safety in how we can use this technology. The simulation in training is another important aspect. Who want to be just trainer and academician can use this part opportunity to become a trainer for patient safety. Medical tourism is a big way, has started in last 1 decade and is still coming more. And to have good medical tourism, there should be an accreditation, and to have an accreditation, there should be a system of patient safety in the hospital. And each and everyone can contribute here by their own role with the patient safety. Concept of systemic approach versus individual approach is a major aspect is changing in futuristic care, and the independent consultancy is happening for the patient safety advocates. Now they are the NGOs and the people who are working for the patients, and they are educating the patients for their rights and responsibilities. So it's another new paradigm where in abroad, US and UK, they are very good professionals who are working for the patients. Now in India, it is also being started. So in next few years, there will be a separate futuristic career will be there for them. Now, eligibility for the going further. If you go systematic way, so 12th with physics, chemistry, biology is the main desirable thing if you want to be there in the healthcare system, so that you can better understand the system and serve better. But it is not only, even if you are there with other groups, there are options available for the lateral entry to serve for the patient. We discuss later as a part. Then the bachelor, yes, all the doctors, the MBBS, BMS, BHMS, BDS, or physiotherapy as a part. The nursing, GNM, or BSc nursing, or paramedic, or BSc medical technology are the desirable part. From management point of view, there is a master in hospital administration is the major key part. If you can achieve that, and then you can be enter into the healthcare organization or the manufacturing industries who is producing for the hospitals. It can be a biomedical equipment, it can be other tools and technologies for the hospitals. And for that, the background is required for that. And finally, the course is specialized for the patient safety and quality. And they are starting with some small courses, certificate, short courses. It can be a postgraduate diploma. It can be a master degrees also available for the same. And another basic inherent skills are required. And there are the analytical skill, decision making skill, the communication skill, and the problem solving skill. If a person having these four skills and additional as a part of the technical knowledge, they can do wonders in this career. And the career entry to the expert is a part, as they have to start with the small awareness program. It can be a 1 hour or 5 days program as a part. It can be a student related counseling, and the professional development will be there. Further, qualified personnel work in a healthcare setup. They work for the patient safety as a part from beginning, and there over a period of time, more than 10 years of experience if you have in working, then you have to develop the portfolio simultaneously. Then you will be an expert in the field, and they can serve the community. The major fundamental training difference here from the other courses required for any career is learning by doing. And that is why after the minimum graduation or in any field or specific field, you have to work for the patient, with the patient, within the healthcare system or the industries who are producing equipment or technologies for the patients. If you work there, simultaneously you learn the things and all the things happen. So you learn, you earn also at the same time, you develop your career path, and there is a future promotion in the bright career ahead. And options available for this, they are based on the basic qualification and quality of the candidates. It can be 3 to 5 days certificate course, 3 to 4 months certificate course. These are the most popular nowadays. For hospital admission people, there are 3 to 4 month postgraduate diploma courses are available. Even some doctors and nurses are opting for the part, or the student simultaneously doing with the BSc or any other graduations. They can opt for these courses parallelly online or offline, or the mixed type of the courses are available for the same. There are short-term, long-term certificate programs by the many bodies, national, international bodies they are doing. There are master courses for the 2 years are available for the particularly patient safety champions, and they are available in the abroad. Also, the e-learning as well as the contact learning sessions are there. There are fellowships, particularly by ISQA, like international bodies, the WHO, the local. In India also, there are so many organizations are there who are providing these fellowships. The self-paced online module and certification are also available, so that while doing your earning and you're doing job, you can also go ahead. And it is also part of the Master of Health Administration program. If you're at mid-career, who you are, can be anybody. If you're a doctor, you're a nurse, you're a paramedic, or you're an engineer, or you're a designer, or a counselor, or you have done MSW, even though you can give your contribution for the patient safety, quality improvement, and ultimately you can be a champion and you can have any post as high as like CEO of as a part, if you have skills and dedication to work for the same. For example, how designer can help. So if a product designer can design some new things which is help in the prevention of patient fall, some engineer can design an infrastructure of a hospital so that there is a less patient fall, there is a good access to the different utilities of the part, then it's a very good requirement of building a new hospitals. If an engineer develops some equipments which are old nowadays and there is some limitation in that, they do the innovation and there can be a breakthrough. For example, telemedicine nowadays is very much helpful in this era of lockdown. There are equipments like patient at home apply the sensor on the body parts, and the doctor can monitor from home, even 1,000 kilometers away. The robotics, what the engineers have developed, the fine system, like even sitting in Ahmedabad, the patient can be operated thousands kilometers away with the help of computer. So IT team can also do some wonders with the healthcare, right? So doctors, nurses, and the paramedics, they are doing major part. The 70% force is there, but these are the other lateral opportunities also for the other professionals who wish to be there in healthcare. They want to work for the patient, but they have missed the train, or there is some problem in not getting into the admissions because of the current educational system. But they can be still there in the patient safety and quality improvement. These are the organization in India. They give the different courses, like NABL himself. The regularly, if you visit the website, there are 1 day, 3 days, 7 days courses are there, and then also some modules are there. Time to time, NABL, CAHO, and AHP are also using these different courses related to patient safety and quality improvements. There are hand-holding courses are also available. There are e-learning as well as contact session and combination, both are available. Medversity, the Apollo Hospital is also having a different type of programs, with the simple like counselor to the high champion and master of hospital administration also there. Then Tata Institute of Social Sciences is having a unique program which is work with the patient and within the system, how they can develop a new project and curriculum by themselves. The candidate has to design their own course. Amrita Institute Kochi and the Indian Patient Safety Organization also coming up with the new modules. And still there are many more in pipeline. In this last 3 months of the COVID, people have realized that how they can contribute differently and by different modes. These are the different international organization, particularly the AHRQ, ISQA, IHI, working mainly for the patient safety and quality improvement, and they are providing very good courses and customized courses as per the need. Harvard, Hopkins, and the very big universities of California as a part. They are also giving an international, even if you are in India, you can opt for these courses. There are online certificate courses, and you can just have to send your portfolio by working in India, and there is a very good opportunity to work for that. These are the references I took from the different net searching, and they are very good. If you go through this literature, it will be very helpful to you and give you a better perspective in this research as a part. There are some of these another Indian part and international websites which gives the different courses and paradigm for the patient safety and curriculum as a part. So wish you all the best by choosing it and how to go further. And I conclude my talk here as a part, but I'm just limiting my talk for some minutes and giving more time for the question answer. And if any queries are there, for any questions are there, what will be the job profile of such people in a hospital or in industry as a part? So usually, if they are doctor or nurses, they are usually doing their duty as a part, but additionally or specifically dedicatedly, they are looking after all the data available for day-to-day functioning, from admission, investigations, laboratory and imaging, patient care, medications, and finally discharge. At all point of time, they are monitoring the things by different data points, and they are analyzing this data point and giving back to the all the stakeholders, so that there is a framework is available. On that, they can do the continuous improvement, and the continuous improvement is the main goal of this. Not only that, there are the 6 major aspects where they are looking after, and that is a prevention of patient fall, correct identification of the patient system. They are looking after the surgeries. They are looking after the investigations. At the same time, medication management, starting from procurement to final patient consumption and monitoring. So everywhere they are coordinating with the main team, the core team, the doctors, nurses, and paramedics who are working on the front line. They are these patient safety champions or the coordinators work behind the curtain and giving the strength and help them to go further. Other are like medical director coming from the patient safety background. They can raise this organization to a different level. And we had seen in India also, not only abroad, that who have this background of patient safety and quality improvement, those hospitals are now achieving more and more awards. And if you see the newspapers, all these hospitals who are getting awards for different performance and beauty of work, you will see that they have this background. Whether all these courses are explained here are approved by the Indian universities, yes, there is a background. Many courses are from the university only. Some of these courses are accredited by some of the bodies who are working for patient safety. They may not be directly as a part, but if you go to any recruiting agency or the any hospital or healthcare where you are doing the part, it will be your additional portfolio. And nowadays, the single degree is not useful. So working portfolio is more important. If you work with some degree and specialized courses, and your work experience will give you the edge over the others. Biomedical engineering is associated with the patient. It's a very good part, as I told, the sonography machine, ECG machine, the multipara monitors in ICU. This is the COVID scenario. Actually, these biomedical equipments only are helping the doctors and nurses to monitor the patient, and they are working for their safety overall, right? So these biomedical equipments is a major tool, and the new initiatives and patient safety modules and features are available now in there. No, it is not only for corporate hospital. Even as I told, NQAS is started for all the government healthcare facilities, and there was a big recruitment in last 5 years in all government setups, including PHC, CHC, all government district and state level hospitals. So it is nowadays mandatory for them also to go for national level part. What they are doing, there is a peer review by the similar kind of hospital. There is a state level team will come and review these government facilities. At the same time, they have national team also coming up and visiting and looking after the patient safety and quality improvement. So it's a very big need across the India. And if we say, take the words of Devi Shetty's apart, there is a requirement for more than 2 lakh such employee or the people across the India. But nowadays, whatever available are even less than 5,000 as a grassroots or core workers. There are also, if you combine together all supportive worker, then they can be a many. But still, they are not more than 10,000 or 15,000. We require many more. Yes, apart from NABH, there's a NHRC, as I told you, there is separate body is looking for the NQAS, and Quality Council of India is a body which is looking over and above NABH, NABL for the blood bank safety. There's another body is ISO, as I mentioned in the part. For basic qualification, as I told in the lecture as a part, you can be a doctor, nurse, or paramedics. You can be a hospital administration. If you have done master in hospital administration or bachelor in hospital administration, you can opt for it. I know many people like engineering or designing background, like product designing is another issue, or some of the designing garments, even if we say for the patient point of view. So there is a unique place for each industry which is directly or indirectly contributing to the hospital and patients. Yes, very good question is a part. Industrial safety, if they work as a part, see, hospital is not one small room. Now, if you as a part, there are so many departments that are working, like oxygen supplying department, electrical department, the chiller plant and oxygen plants. There is a facilities, a project management as a part, or maintenance as a part. There is a people movement and public movement is also there. You need to also manage the crowd as a part. So industrial safety in one aspect, if they were experienced, if you pursue this, some of these courses available, you can do wonders in this part. I know, like fire safety officer in one of the my hospital where I'm working, like he's mainly background of working in fire safety mainly, and some paramedic military also as a part of what he has done. But now he's contributing a lot. He's training all our doctors, nurses, and all the entire staff for fire safety and electrical safety. And is a big asset to our organization. One question I miss is the research. Yes, research is a big role, and there are especially journals are now there for quality improvement and patient safety. In the BMJ, there is a separate chapter, British Medical Journal. Even the WHO is also the same part. In India, also people are working for the patient safety and part. So research is a big role, and I told in my presentation, quality audit, clinical audit is another aspect. It is similar like research as a part, and have a big role for this in quality improvement and patient safety.
So I would really like to thank everyone for coming in today and attending today's webinar. And also thank you, Dr. Nitin sir, for coming in and giving this wonderful career option for all the medical aspirants. And I hope to see everyone again soon. Yeah.
Okay. Thank you. Thank you, ma'am.
Thank you so much, sir.
Welcome.